A very good afternoon to all for the second session of the day on anti-mortem and post-mortem inspection of poultry on a food safety perspective. So, for this topic, I request Dr. M Thang sir, who is working as a assistant professor in Veterinary College and Research Institute, Udumulapete, and how we will handle this session for anti-mortem and post-mortem inspection of poultry on a food safety perspective. Sir?
Okay, sir. Shall I start?
You can start, sir.
Sir, is it visible?
Slides தெரியல.
One minute. Welcome, Dr. Ruba.
Thank you. ಏನ್ರಿ ಕುದುರೆ ಮೇಲೆ ಕೂತಿದ್ರಲ್ವಾ? ಕುದುರೆ ಓಡೋ ಮಟ್ಟಿಗೆ ಬರಲಿ. Yeah, voice break ஆகுது.
வாய்ஸ் பிரேக் ஆகுதா? கிளியரா இருக்கா?
இப்போ கொஞ்சம் சவுண்ட் கொஞ்சம் இன்க்ரீஸ் பண்ணிங்க சவுண்ட்.
Okay, sir. Visible.
ஓகேவா?
Okay.
Shall we start?
Sir, you can start.
Yes, sir. Thank you, Dr. Rajendra Kumar and Dr. Selvam. Good afternoon, everybody. This session may go for another 1 hour and 15 minutes, as Ruben suggested. I break this presentation into 2 parts. First part is familiar for you. You people are specialists in that. And the second part is post-mortem examination of some specific diseases. Okay. So if you have any doubt in the first part, I request Ruben and Selvam to intervene and answer. Okay, Ruben. Ruben, is it audible?
Okay, sir.
Audible, clear?
Clear.
Okay, the presentation goes like this. First, we'll see some introduction, why this antemortem and postmortem inspection are needed. And then we'll see the general meat inspection procedures of like antemortem and postmortem examination in general with all animals. Then we'll go for specific poultry meat inspection, antemortem and postmortem. Based on the antemortem and postmortem, we have to make some judgments whether to accept or condemn the meat. So it goes like this. As there is a famous saying, like a man is who one what he eats, right? Because based on the food, our body and the mind are changing. And we have a report from WHO that there are around 1 lakh deaths per year in India because of foodborne diseases. This is not only from the meat, but also from the other food. And in this, mainly the children of less than 5 years are getting affected. About 40% of the children are under more risk, and they are recording about 30,000 deaths per year. And in 2011, WHO recorded 100 million foodborne diseases cases, that is infective cases, that may go rise to 150 million in 2030. That's what they are threatening. This gives why the antemortem and postmortem inspection are very essential. In India, we have Food Safety and Standards Act 2006, which also instruct to ensure the availability of safe and wholesome food, including meat and other food for human consumption and for the other matters which are connected with the food. So that's why we have to do antemortem and postmortem inspection, particularly in meat aspect. The main foodborne pathogens, they started giving troubles and which cause public health hazards. We know very well that the Salmonella, Campylobacter, E. coli, Toxoplasma, Yersinia, they have causing very important public health hazards. And our Swachh Bharat mission by our Prime Minister, they are saying there are some reports that because after starting the Swachh Bharat, there are decrease in the incidence of foodborne pathogens. That's what the report says. So in general, the main objectives of conducting meat inspection is to inspect the animals, and the normal animals which are physically healthy, they have to be slaughtered for human consumption, and the abnormal animals or diseased animals are to be separated and they have to be treated accordingly with the standard procedures. And the meat should be free from any disease, and it should be wholesome, and it should not cause any risk to the human beings. The antemortem inspection goes like this. It started with examination of live animals, so within 24 hours before slaughter. If the slaughter is delayed, and it has to be repeated after that. And it should be done with adequate lighting, and we have to examine the 4D of antemortem inspection, that is down, condition down, and disabled, deceased, or dead animal. The animals have to be examined in a group, collectively and individually, and they also have to be examined during the motion and also at rest. And we have to examine the general behavior of the animals, nutritional status, cleanliness, and if there are any signs of diseases and other abnormalities. So in antemortem inspection, we have to screen all the animals, and we have to separate the dirty animals from the good ones, and we have to condemn the animals which are exhibiting some disease signs. And injured animals and animals with severe pain, they have to be treated as animals requiring emergency slaughter. And if there are any reportable diseases, that has to be dealt separately with caution. And the sick animals with antibiotic treatment or the residues, that has to be separated. And apart from the inspection of animals, we have to ensure the cleaning and disinfection of the trucks and also the slaughterhouse. That also comes under the anti-mortem inspection. During anti-mortem inspection, to track back or to take care, we have to record the name of the owner, and we have to record the identification of the animal, including species, sex, age, color. And the main thing in antemortem inspection is the general physical examination. There are some physical method of examination. The main three things are auscultation, recording temperature, and recording pulse rate and respiratory rate. And we have to observe the general behavior of the animal and the gait, the posture, and if there are any discharges and any protrusions or physical exhaustion or abnormalities. And we have to check the mucous membrane, visible mucous membrane, and look for any abnormal color and if there are anything. General physical examination, which gives clue to suspect some diseases or some conditions. That's the very important thing in antemortem examination. Based on this, we have to make some decisions in antemortem examination. If the animals are free from any disease or any abnormalities, they are fit for slaughter. And if we suspect some diseases or some conditions which may make the meat unwholesome after postmortem, after slaughter, that has to be kept as suspects. And sometimes conditional approval, that is some part of the body, organs or the meat part are trimmed and they are approved for mere consumption. And sometimes the slaughter is delayed. We'll see one by one. And this next slide: casualty slaughter, emergency slaughter, and some of the things are unfit for the slaughter. In special precaution are that conditionally approvals, some localized condition, we can trim the things like abscess, local abscess, or some local skin tumors or some injuries, then we can approve. And in delayed slaughter, if the animals are exhausted or excited or they are in transit sickness, so that we have to delay the slaughter. There is another one is casualty slaughter, that the animals are affected by chronic conditions. They are not in acute pain or some severe injuries, or they are not in immediate danger of death. They can be put in casualty slaughter, like aberrator paralysis in cattle and buffalo, postpartum paraplegia, and some of the benign tumors. The opposite one is emergency slaughter. In that, in case of severe fracture, or pelvic fracture, or forelimb fracture, or rib fracture, the animal experience a severe acute pain. That animals has to be slaughtered immediately. And of course, we have to conduct antemortem and postmortem examination in that animal also. Without doing that, we should not slaughter. That's emergency slaughter. And some animals which are unfit for the slaughter, sometimes mistakenly they may come to the slaughterhouse like very immature young animals and animals in advanced pregnancy, or which are in recent parturitions, and dead animal, moribund animal that is going to in die state, and animal which are highly emaciated and septicemic and some contagious diseases. They are unfit for slaughter. The examples, few examples are anthrax, rabies, black water, F1B, swine fever, and that's regarding the antemortem inspection in general. In postmortem inspection, it starts from the stunning of the animal until it reaches the cooler, the meat. So we have to examine all the way from stunning to cooler, and the postmortem examination should start immediately after the slaughter of the animal. And we have to examine all the organs and the carcass parts, and before it is being removed from the floor of slaughter, right? As such, as in situ, we have to examine the organ. Then after that, we have to do some systematic examination, including all the system in the dressed carcass, which includes all the organs, including blood. We have to examine. And based on the some lesions, we have to detect some of the diseases, and we have to eliminate the abnormalities and contaminations. By seeing the meat, and sometimes you have to do incise the organs and look for any lesions, and we have to palpate the organs, and we have to use a smelling sense also. Sometimes the lesions we have to ascertain whether it is acute lesion or chronic lesion. Because based on that the judgment may vary, uh, and we have to see whether the lesions are localized or the lesions are generalized. And final diagnosis we can make based on pulling the observations of antemortem and postmortem findings. Sometimes in case of suspects, we can send the samples to the laboratory, and we can hold the procedures till the results of laboratory came. In case of trimming and contamination, we have to whether we have to trim the portion of your carcass or the whole carcass. Based on the results, we have to see the whether it is abnormal or diseased, or if it is hazard to the human health. Sometimes it may be in good health aspects, but sometimes it is repulsive to the customer. That also have to be condemned. So how to identify the localized and generalized lesions? So localized conditions, it's very simple. Like if it affect only a particular part, it's not spreading to the whole corpus. The abscess we can consider as a localized. Sometimes if the liver is getting affected, the entire body appears ectric. But in that case, we can remove only the liver, and we can use the other parts of the body. In case of generalized condition, if you see some lesions throughout the body, throughout all the systems, first thing we have to examine the draining lymph node, because draining lymph nodes are very important one, which gives a very good clue for the spread of the diseases, right? A tumor or any infectious disease, that lymph node, draining lymph node is very important. There are some signs in generalized diseases when we suspect. We can see the inflammation of all the lymph nodes, including internal lymph nodes, mesentery lymph node, pelvic, iliac, and the peripheral lymph node also, starting from submandibular, prescapular, inguinal, axillary. All the lymph nodes are enlarged, and sometimes inflammation of joints. And lesions is not restricted to one organ. You can see the lesions in many organs, mainly the septicemic conditions we can see, and multiple abscess. And here, in localized condition, we can make judgment by trimming that and this. But in case of generalized diseases, it needs some more severe judgment whether to accept or condemn the corpus. Next one is we have to assess whether it is acute or chronic condition, the lesions. The acute conditions, the lesions develop within some days. But chronic conditions, they develop, the animal is suffered for a week, months, sometimes a year in some of the diseases. Most of the chronic conditions like our tuberculosis, jaundice disease, actinomycosis, actinobacillosis, they are chronic conditions. They produce some granulomatous lesions. It needs some weeks or months for the development. In case of acute stage, we see inflammation and large hemorrhagic lymph nodes, mainly the petechiae, the pinpoint hemorrhages in the mucous membrane and the serous membrane. What we are seeing here is peak tachyec appearance in the kidney, and this one is a splenic infarct. Both are acute condition developed in days. Generally, chronic conditions we see, along with inflammation, we see some necrosis, fibrosis, and sometimes abscess. They may adhere to the adjacent organs or that serosa or the covering this thing. In chronic condition, if it's a less severe, we can remove the affected parts and use. But if it's a generalized necrotic tissue, and with the evidence of previous infection, we have to condemn the whole carcass in case of chronic conditions. Like ante-mortem inspection, we made some decision. Here in post-mortem examination, after that, we have to make some decisions like whether we have to approve the carcass if it's free from all diseases and abnormalities. And if there are any disease or conditions which makes a meat which is not suitable for human consumption, that has to be condemned totally. Sometimes in case of local lesions, the partial condemnation being done and then it is approved. Sometimes conditionally approved, it may look like with some affections, but if they are treated and it may become good for human consumption, that they are conditionally approved. Sometimes meat hygienic point of view, it may look good, but in it's not acceptable standard, that's inferior meat. And sometimes if the disease, the slaughters in a particular area which are affected by contagious diseases, that is not being brought in out of that particular area. That's approved only in that limited area. It's not allowed in outside the area. So, as a general rule, if the lesion is acute and generalized, we have to condemn the entire carcass. And if the lesion is localized and chronic, it needs only local condemnation. That's about the general, and we'll move on to the next one. That's inspection of poultry. As the Poultry Products Inspection Authority, in case of USA, they are standardizing. They are giving some norms to inspect poultry. So during, in case of poultry inspection, they have to be inspected prior to slaughter. That is ante-mortem inspection. And after that, after the slaughter, that is then goes for post-mortem examination, and they have to be again inspect before processing. Apart from the poultry, we have to inspect the plant also, and also we have to observe the operations, the procedures involved in the slaughtering of birds, and also the processing procedures. Until the product labeling, we have to inspect and verify the truthfulness and accuracy of the procedures. That's what they suggest. So the inspection of poultry, it started like this. Before doing ante-mortem examination, we have to check the food chain information given by the farm. Right? I'll show you in the next slides the what all the information should be there in the food chain information. So based on the food chain information, we have to make some analysis. If it's okay, then it is proceed for the ante-mortem inspection. If there are some problem, that warning conditions like disease or some disabilities, we have to look for expert opinions and then get the permission whether to proceed or not, then goes for a post-mortem examination. At every stage, we need the expert opinion, particularly from the veterinarian in charge of that slaughterhouse or the farm. So this is a food chain information form that this has information regarding the farm address and regarding the information of the birds, the number of birds and the flock number and the type, how they are maintaining, how it is produced. And it also includes in the second part the feeding program. And in the third part, it contains the production data and the flock health status. This is very important because and before sending for slaughter, they have to examine for the salmonella. They have to get the certificate like a salmonella negative, and also they have to give the some of the information like any other diseases or whether they are treated for anything. And when it is removed from the farm to the slaughterhouse, that's very important because if it for so many days, then we have to examine again. In case of poultry, why we have to do antemortem and postmortem examinations? There are some risks. Mainly, there are three types of foodborne risk factors as suggested by FAO. The first group is microbiological factors, and the second group are chemical factors that includes the residue from medications that we are using, antibiotic and the pesticide. And the third group comprising of physical hazards. So first one is microbiological risk factor. This contains the diseases caused by virus, bacteria, fungus, parasites, everything. Because the poultry comes in the higher risk category in the food pyramid. Food risk pyramid, it comes in the higher risk category. Because in case of foodborne infection, mainly from the poultry meat, 25% of the persons getting salmonellosis needs hospitalization. In case of E. coli, colibacillosis, 50% of the affected person, they need hospitalization. And in case of listeriosis, 90% of the affected person, they need hospitalization. So this gives why the antemortem and postmortem inspection is very important. Clostridium and norovirus, they also cause some foodborne diseases. And the Campylobacter, they cause very severe dysentery, and it though not like Salmonella and E. coli, but they are also causing some considerable amount of diseases in human beings. In Jan 2020, there are some petitions to FSIS in SA to consider the following 30 serotypes of Salmonella to declare as outbreak serotypes. So now we can assess the seriousness of the Salmonella, because it causes so many cases every year, and year by year it's getting worsened because of the resistant strains produced because of the indiscriminate use of antibiotics in the feed and in the poultry as a growth promoter or as a feed additives. The bacteria are getting resistant to the normally used antibiotics, and the severe forms, strains are developed, and they are causing that normal drugs are working in human beings. And in case of Campylobacter, they cause very severe gastrointestinal diseases, mainly by Campylobacter jejuni, and very rarely Campylobacter coli causing the disease. Sometimes the peripheral nerve affecting conditions, Guillain-Barré syndrome, also caused by this Campylobacter associated immune-mediated diseases. Apart from the Salmonella and Campylobacter, sometimes Clostridia and Listeria also causing the disease. And very importantly, the E. coli, mainly the strain O157H7, which causes very severe illness in case of human beings. This was spread from the meat. Apart from that, in the second category is mycotoxins, which are the toxins produced by the fungus. The main mycotoxins are aflatoxins and acrotoxins produced by the Aspergillus or penicillium species. And there are some diseases which are thought to spread from the poultry. Eastern encephalitis virus, St. Louis encephalitis virus, but they are not spreading by eating the meat, because these encephalitis viruses, they are spread by the mosquito bite, right? We can use a chicken as a sentinel animals to, if we want to screen an area which is endemic for encephalitis, we can take some samples from the poultry farm. If we check the chicken, if it contains, then we can conclude. They are used as sentinel chickens. But there is no evidence of transmission of encephalitis virus from the meat to human beings. And another important, which is spread during handling, is avian influenza. And again, this also not by transmitted, by eating the meat, but while handling, this virus gets spread. And other things are parasites, which they are not that much important because the human infection from the poultry parasites are very rare. And the prions, they are not concerned with the poultry, they are mainly cattle and sheep. And another very important thing is the resistant strains of pathogenic bacteria. That's a very important one. And the second major category is chemical risk factors, because the chemical substances they are accumulated in the poultry meat, and the main things are the residues of antimicrobials, microbials, antibiotics that are used in the feed or feed additive or growth promoters. They are sometimes during if the animals are in treatment, we have to give some period for the all the residues getting excreted out, all the antibiotics. And from the environmental pollutants, that organic and inorganic materials get uh, residue in the animal, poultry meat, and also the pesticide residues. They are also posing some risk factors. Right? Antibiotic residues, as we saw already, some of the antibiotics are banned in European Council. Of course, I don't know about our things. Mainly the bacitrazine, salinomycin, and monensins are very commonly used in the poultry industry. That also poses a very big problem because of they are developing the bacteria, resistant strains of the bacteria. Regarding the pesticides, they produce acute toxicities and chronic toxicities, mainly the hexachlorocyclohexane. This one is in North India, Himachal Pradesh, Uttar Pradesh. They randomly check the meat and the feed. In case of meat, we can see around 68 to 66% of the meat they contain the residues, and overall 83% of the eggs and 92% of the livestock tissue they contain a residues of mainly the HCH, DDT, and aldrin at the toxic levels because of the not conducting antemortem and postmortem examination and this thing. And the next one is the disinfecting agents found in the meat, which is mainly we use the chlorinated water for the washing of the cleaning of the slaughterhouse, which is now banned in European Union, but USA and India it is allowed. We are using chlorinated water for cleaning the utensils, materials, and slaughterhouse. So they are the risk factors of the in case of poultry meat, that gives us the importance of antemortem and postmortem examinations. In case of poultry, antemortem inspection, they are not like animals because it's very difficult to examine the individually as in animals, because they are coming in crates on lines. Sometimes, in case of high density groups, people used to take a statistical sample of birds and they examine. And overall, we have to assess the general health status of the birds by looking head, eyes, legs, and body. Head gives clues for majority of the infectious diseases, heads and eyes. And if there is any normal swelling and any other abnormality, you have to record. And this each flock before going for slaughter, that has to be attested by the veterinarian whether they are fit to slaughter or not. So as with the animals, general we saw already, we have to record the date and time of inspection and the truck number, a species, the total number of birds are going for slaughter, and the name of the owner, that means the form particulars. Everything is there in the FCI form. If the FCI form we can record all these things from there. So as with the general examination, the objectives of poultry antemortem examination is we have to assess the general health status of the birds, whether they are fit or whether they are affected by any disease or any conditions. They need some special attention like segregation, or if they need some delayed slaughter or adjustment of line speed to decrease line speed and to make the inspection thoroughly. Sometimes we have to take some special cautions, like some inclement weather, like winter, which needs immediate slaughter. And in case of summer, we have to take care of while transporting the bird in the truck or in the holding area. We have to take care of avoiding heat stress or heat stroke to look for the air exchange, everything. And if there are some reportable diseases like avian influenza and Newcastle disease, that has to be informed immediately to the veterinarian, and it has to be recorded, and it has to be informed to the government authorities, particularly in case of avian influenza. And sometimes some diseases, they look similar in case of antemortem examination. That also have to be taken care, like avian influenza and Newcastle disease, very virulent Newcastle disease, they both alike same. This one, in Western, they are using some inspection system, like apart from traditional system, they have SIS and the new line suite system and NPIS, and they are separate inspection system for turkey and rat. And after evisceration, every bird has to be checked for the fitness of the carcass, and we have to examine each carcass and all the organs before discarding any part. And Food Safety and Inspection Services of USDA, they are giving some laws whether to accept or condemn. This we'll see one by one in disease aspects. Like TB has to be condemned, but in India we have sometimes in case of TB we can trim and use, and lipoid glucose is condemned. Septicemic animals in animals and birds everywhere, it has to be condemned. Systemic changes and septicemic changes and generalized things. But in case of inflammatory process, tumors, parasites, and bruises, we can trim the part and we can use the other parts based on the extent of the disease or extent of the affections. But in case of overscan, that has to be condemned. And in case of decomposed animals, if the animal is brought dead and it's getting delayed, the bird gets decomposed. So we get the putrefied smell. And very importantly, we can see the greenish black discoloration of the skin, particularly the ventral abdominal skin. If we see the greenish black discoloration, we can say the bird is decomposed. And even after opening, we get the smell and the meat, the intestine, internal organs, they are becoming soft and pulpy. If these changes are very minimal and superficial, they can be trimmed and used. Otherwise, it has to be condemned. And if it is contaminated with microorganism, that has to be condemned. And sometimes it is contaminated with some oils or paint or some poisons, gases. They have to be condemned, right? Accidental condemnation. But if the meat is contaminated with the digestive tract contents, they can be cleaned and reprocessed, and they can be used, and there is no need to condemn the entire carcass. So this is a general flow diagram of the antemortem and postmortem inspection of the poultry. It started with the food chain information. Based on the food chain information, we can proceed for the antemortem inspection. And in the processing plant, it started with antemortem inspection from the arrival of the birds, from there till stunning, then the postmortem inspection until it reaches cooling. Every stage we have to examine. There is a procedure, HACCP. Critical control point analysis, you know that. Okay, so this completes the first part of my talk, and We'll proceed for the specific diseases in the next part of the talk. Dr. Ruben, are you there? Dr. Ruben, anybody is there? Excuse
Yes,
me.
sir. Yes, sir.
Ruben. Okay, sir. Is it okay? Shall I proceed?
Yeah, please, sir.
You want to? Okay, Ruben. I'll proceed with the special diseases here. Mostly we see the lesions and the clinical signs of the diseases. We start with viral diseases of poultry. First most important disease is poultry, mainly the high pathogenic avian influenza, because it spreads very fastly and it causes very severe systemic diseases. Most of the time, before we observing any clinical signs, we found the animal dead, and sometimes it shows neurological signs. This depression and anorexia full feathers, we see these depression and anorexia full feathers in all the diseases. So based on these three clinical signs, we cannot make any conclusions. Okay. In case of avian influenza, the very important thing we have to observe is the cyanosis or the hemorrhages. In case of comb, battle, and the shank. That shank hemorrhages, what we are seeing in the left top, the shank hemorrhage and shank cyanosis is a very important clinical signs. We can suspect avian influenza. In no other disease, this shank hemorrhage and shank cyanosis we could see. Apart from that, comb and battle, severe congestion or hemorrhage, and cyanosis. In this, you can see the normal bird with healthy comb, and this is a affected disease. And here also you see the battle and comb cyanosis and congestion. Apart from that, you can see the severe hemorrhages in case of face, right? Face, this also thing, and sometimes there is a swelling of the battle. At the initial stages of avian influenza, the bird may show greenish diarrhea at the initial stage. These images, this will confuse with Newcastle disease, because in case of Newcastle disease also we have this greenish diarrhea and facial severe congestion, other things. This is very peculiar for avian influenza, that is ventral abdominal skin hemorrhage. This somehow it is peculiar for avian influenza, what we are seeing in the first image. If we see this one and the shank hemorrhage and the shank of this thing, we can consider and we can take the samples for avian influenza. And in case of postmortem examination, if we open the board, we could see the pedicle hemorrhages, that is a pinpoint hemorrhages, everywhere inside the body, almost all the organs, starting from the heart, intestine, ovaries, mesentery, everywhere inside the body, you can see the hemorrhages, including trachea, proventriculus, and in case of even in the abdominal fat, we could see the severe hemorrhages. And all the lymphoid aggregates in the intestine, they show necro-hemorrhagic lesions. So outside also hemorrhagic and inside also hemorrhagic, if we see, we have to suspect avian influenza, and the judgment is very simple because it's a zoonotic importance in case of human beings, and not by eating the meat, but during handling the virus may get, because it's a respiratory, it spreads through inhalations. So the caucus, everything has to be condemned. The next thing, which is closely related with avian influenza, that's a very virulent Newcastle disease. With the same type of lesions in antemortem signs, but here it shows respiratory signs. This makes the things difficult with some other disease like infectious bronchitis, we have to do some differential diagnosis. Here also it shows a severe greenish diarrhea. Apart from that, uh, the very typical clinical sign is torticollis of the neck. Almost in all the boards affected by NTB, we see this tilting of the neck, right, torticollis. And some, because of the respiratory system getting affected, we could see the some discharges and also the difficulty in breathing. And the bird showing greenish diarrhea, and it's showing sitting on the hog. It's very characteristic clinical signs in case of Newcastle disease. And in case of human, it was severe conjunctivitis and mild fever. You can say mild myalgia throughout the body. In case of postmortem examination, you could see the facial severe hyperemic or congestion. You could see, and organs. In case of proventriculus, the papillary tip of the proventriculus papillae, they show severe hemorrhagic lesions. They are getting inflamed. We could see the highly prominent proventriculus papillae. It's highly prominent, enlarged, and it shows hemorrhagic lesions at the tip of the proventriculus. Apart from that, the second important area we have to look for is the cecal tonsils. It shows necrohemorrhagic lesions here in the cecal tonsils, very characteristic lesions. Proventriculus lesions and the cecal tonsils lesions. Apart from that, it shows a severe congestion in the other organs also, including ovaries. And the spleen getting enlarged, and it shows multiple white patches. They are reactive hyperplastic this thing. When a bird is suspected for Newcastle disease, it should not be allowed into the slaughterhouse. It has to be segregated, and samples has to be sent for the laboratory confirmation. If it is confirmed and carcass is condemned, and the premises should be disinfected. Sometimes, if the laboratory confirmation is not possible in some areas, but if the animals, the birds are showing clear clinical signs and lesions, and the suspected carcasses has to be condemned even if the laboratory results is not possible. And another important viral disease is infectious bronchitis, which affects the respiratory tract. So it produces some caseous plague in the respiratory passage. So the animals, the birds, they show some difficulties in the breathing. It's very easy to identify. You can, before you reach the farm, you can get the clear, moist rails and the gasping and the sounds and the respiratory growling sounds. Right. So the birds, they show the open mouth breathing. They huddle together, and the eggs, they are showing some changes externally and also internally. Externally, they show some soft shell eggs, and you can see some roughness over the shell, some calcareous deposits. And in case of inner quality, if you break open the eggs, and normally the right side is a normal egg, and left side is IB affected egg. In normal, you can see the egg yolk, chalazion, and the thick albumin and thin albumin. But here, in case of IB affected bird, the egg shows yolk, and there is no separation between the thick and thin albumin. So the albumin become watery. Watery thin albumin is a very important internal egg quality in case of infectious bronchitis. And there is a severe, you can see the caseous plaques in the lower part of the trachea, mainly the bifurcation. In that area, if you see the caseous plaque, we can suspect the infectious bronchitis. And there is another form, nephritic form. In that, you could see the deposition of urate in the ureters, uric acid crystals in the kidney. And because of the kidneys getting affected, it produces there is a condition called visceral gout. There is a deposition of these materials inside the over the pericardium and the liver, right? we should not confuse this lesion with pericarditis and hepatitis of E. coli or other salmonella and foul calm. This is visceral gout. And these, the lower two pictures are nothing but the cystic development of the oviduct. This third condition of the infectious bronchitis, which affects the reproductive system, which causes inflammation and obstruction of the oviduct, and there is a cystic development of the oviduct. If the disease is acute and the board showing very severe emaciation, it has to be condemned. And if the flush is good and there is no, if there is no systemic changes, we can approve, and by just by condemn the affected parts. The next one is the infectious laryngotracheitis. This affects the chicken, pheasant, and poults. Turkeys, ducks, and geese, they don't get the ILT because of the affinity. And here it's very easily you can identify by in the form itself. You can see that mucus mixed with blood mixed mucus with a thread-like thing. It's hanging from its nostrils, and sometimes we could see like blood splashes on the floor of the farm or the house. And because of the trachea getting affected, this disease affects only the upper respiratory tract, not the lower one. It's upper respiratory tract disease, and it's being occluded by this hemorrhagic blood material. So the birds getting difficult for respiration, and we could see the hemorrhagic gaseous material, necrotic material inside the trachea in severe cases. So this HP could see how much it is occluded in the trachea. And of course, it's showing some inclusions. That's not needed here. And in case of initial stage, it's the trachea that contains only the yellow caseous necrotic material. Sometimes it may look like infectious bronchitis, but we have to look for some hemorrhages in the lower in the trachea, and we have to look for other lesions in case of infectious bronchitis. If the disease is very mild and the bird is recovered and with the good flesh, we can approve. If the bird showing general systemic changes, the whole carcass has to be condemned. Next one, foul pox is very easy for identification, and there are two types of foul pox. You know already, wet and dry form. Dry form, it's a cutaneous form. This very easily you can identify. The main problem is with the wet form of the pox. There we could see the species plaques in the inside the mouth, and sometimes in the oropharynx, and in the esophagus, and in the trachea. This gives doubtful whether it is IB, or sometimes if we see the lower right bottom is esophagus, we could see the small minute rubbed white things. This has to be differentiated from the vitamin A deficiency. There it produces some lesions like this. Vitamin A deficiency that can be easily enucleated, that you can easily remove, but here because that is in case of foul pox, it cannot be removed easily. That's one thing, and otherwise you have to confirm with the HP for Bollinger bodies in intracytoplasmic inclusion bodies in case of foul pox. And in the judgment, if the lesion is progressive with wet pox, and if the bird is emaciated, that has to be condemned. And if it's only in the local and cutaneous lesions and the birds are recovered, and that meat can be up. Another one is the tumor causing diseases of that is a vindicosis complex that comprise of MDLL and REV. In case of Marek's disease, in case of Marek's and LL, we studied in the textbook that the Marek's comes in 12 weeks birds and the LL coming in the older birds. But it's not so. In both the diseases, they are coming in almost all the ages of the birds. There is no demarcation. You might have seen in your farm. This Marek's disease that affects mainly the peripheral nerves, very particularly the sciatic and brachial nerves. They are enlarged about 2 to 3 times. Usually, if you see the sciatic nerve, you can see the striations, right, like small linings. But in case of Marek's disease, because it is being enlarged, it dematters, fluid getting accumulated there, it becomes glistening and becomes round like pencils, right? It lost its striations. It's a very important and pathognomonic lesions, we can say. And another important thing in case of Marek's disease, when we examine the sciatic nerve or brachial nerve, that is, unilateral affection, right? So when we examine, we have to examine both the sciatic nerve, because if we examine only one side, if we miss the other side, then probably we would miss Marek's disease, because it's getting unilateral affection. That's why it shows a typical paralysis of the legs and wings. You can see one leg or one wing is paralyzed, in which based on the which nerve it's being affected. The tumor is mainly you can see anywhere, including the skin, ovary, lungs, kidney, heart, liver, everywhere. And so in case of skin, we could see the spreading ulcers, hemorrhagic ulcers, and tumors of varying sizes, starting from millimilli to centimeters, and from on the surface, and it is embedded inside the parenchymatous organs. And the tumors are also seen in the testicles of, and there is a battle swelling. In case of clinical swelling, it shows that the squam running posture, because it's affecting unilateral nerve. It's a very typical clinical signs. In case of ND, it affects both the thing, and it shows hawk sitting posture, sitting on its hawk. But here it shows a very typical running posture, and sometimes the tumor cells get being accumulated in the eyes, and it's optic eye form. You can see the gray eye lesions, and here it shows this very severe course of more than 5 times enlargement, and it shows the glistening appearance we could see. And here the cells are T lymphocytes, and if we suspect MD to differentiate from lymphocytosis, even if the HP is not possible, you just make a cut of the lesions, put some impression smears, do staining with the lesion, and if you observe under the microscope, we could see the varying sizes of the cells. That's the important thing between lymphocytosis and Marek's disease. Here the lymphocytes varying from small lymphocytes to lymphoblasts. We could see the varying size of the lymphocyte, but in case of lymphoid leukosis, we could see the uniform sized lymphoblasts. That's the difference. Pleomorphism is a characteristic lesion in case of Marek's disease. As with other diseases, if the disease is a visceral form and extensive cutaneous, that has to be condemned. And if it's only the localized skin lesion, that can be trimmed and uprooted. Even in case of if we condemn that carcass, we can use it for animal food preparation. Okay. Next tumor causing disease is lymphoid Usually, our book says it comes after sexual maturity in older birds, but we are recording in case of postmortem so many cases in very young animals, very young birds. This causes very big enlargement of the liver, so it's called big liver disease, liver lymphomatosis, and visceral lymphoma. There is no specific external sign except the big liver becoming enlarged abdomen. The main difference here between that thing MD, in MD, always it produces tumors, visible tumors. But here it produces visible tumors like varying sizes, or sometimes very miliary thing, which we could not observe as a solitary tumor but the entire liver liver being enlarged. Almost it occupies entire abdomen of the bird. That's why it's called big liver disease. And apart from the liver, you could see the lesions in spleen, burst of Gracious. These three things we get always, and sometimes in gonad, lung, heart, bone marrow, and mesentery. There is no skin lesions like MD. In case of MD, because the feather follicle are the very important source of the virus for the spread. Here there is no skin form. The difference, you know already the difference between. So it has to be condemned, and we may use this for the preparation of animal food. Next is chlamydial diseases. First one is the psittacosis, caused by chlamydia psittaci. This cause some mild respiratory symptoms in case of human beings, and mild fever, sometimes wheezing like problem in case of humans. In postmortem infection, we could see the serofibrinous exudates on all the serosal surface, including pericardium and lungs, liver, spleen, mesentery. Everywhere we could see the serofibrinous exudates. And the confirmatory diagnosis, we could see there is a called LCL bodies, Levinthal Lilly bodies, which is highly packed in the kidney epithelium. That is the pneumonic lesion for the diagnosis of the psittacosis. This is very important, zoonotic importance, because the persons handling or processing the infected birds, they are under high risk, and we have to take care of that. And if you suspect this, then we have to send the samples, and based on the results, if it's positive, we can condemn, and if it's negative, we can approve for the human consumption. Till then, we have to delay the slaughter. So next is very important bacterial disease, which is salmonellosis. We know that there are three groups of salmonellosis. One is non-motile, motile, and motile salmonella, and motile Arizona. And this, in this, very important, based on the foodborne infection, is motile paratyphoid salmonella, which is very common conditions in relation with public health significance. It causes very severe illnesses in humans, particularly in children less than 5 years. It causes pullorum disease in chicks. Mainly, it affects the young chicks. Cause dead in shell, or it dies soon after the hatching. The very important clinical signs, we can see the pasty vein, that is a white, thick fecal material which is stick onto the vein. And in case of growers, the swollen hog joint is a clue for the suspect. In case of chicks, we could see the peritonitis with unabsorbed yolk. When we see the unabsorbed yolk, we suspect colibrullosis also. That has to be differentiated. And in case of septicemic diseases, we could see the septicemic lesions like petechiae and other severe congestions. Suppose if the bird survives the acute phase, and if it dies after 1 or 2 days, we could see the necrotic foci in the liver. Almost in all the salmonella cases, we could see the necrotic foci in the liver. That has to be differentiated from pasteurellosis, because in case of pasteurellosis, that is a very important lesions, the multiple pinpoint necrotic foci. In case of salmonellosis, we could see the very important, very characteristic lesions in the cecum, thickened and caseous materials inside the cecum, and the necrotic foci in the liver and heart. In case of reproductive system, it gives a very clear pathology, like the misshapen pedunculated ova. So you could see the stacks of the ova. These are very important PM lesions in case of salmonella. Misshapen pedunculated ova with stalk attachment. And in case of growers, we could see the joint inflammation, that's arthritis. The next one is the fowl typhoid caused by Salmonella gallinarum. And here the diarrhea, mucoid yellow is a very characteristic lesion at the corpus, is showing septicemic and jaundice because it affects the liver, so it shows jaundice lesions. So the coppery bronze liver, you could see the glistening appearance of the dark reddish liver. That's a pathognomonic lesion in case of fowl typhoid. Apart from that, as we discussed earlier, we could see the necrotic foci in the liver and on the heart, almost in all the salmonellosis. Another one is motile paratyphoid salmonella. There are very important serotypes starting from type Imurium enteritis. And when we open the cheeks, we could see the unabsorbed yolk sac, and that again, as we discussed, it has to be differentiated from the colibacillosis. And typhlitis is another important lesion in case of this. Apart from that, necrotic lesions in the intestine and pericarditis and perihepatitis also being suspected in case of this. This is very important in case of public health significances because they are the leading source of the foodborne illnesses in human being. And another salmonella is Salmonella arizona. It causes, apart from the other lesions what we discussed in the other salmonellosis, additionally it causes nervous signs and the lesions in the eye. That is, eye lesions are making us to suspect for arizinosis. And the dark brownish bone marrow is a very important pathognomonic. It's a characteristic feature of the arizonosis. If we open the bone marrow and look for the dark brownish change. The judgment is almost all the salmonella diseases like Flora typhoid, paratyphoid, and arizonosis. If it is confirmed and all the carcasses should be condemned. Next is fowl cholera caused by Pasteurella maltosida, and the turkeys are more sensitive. You'll see the lesions, and it shows symptoms starting from the respiratory signs like discharge and the swollen battle, swollen comb, swollen face. The fully swollen face. We saw this swollen in case of ND and avian influenza, but here there is no much change like cyanosis or severe congestion. There is a swelling. In case of chronic infection, that swelling it is getting infected, and it shows during cut open it shows excretion of the pus material. If we open the bird, that shows a very typical classical lesion starting from the multiple petechiae on the heart and multiple pinpoint necrotic foci in the liver. If we see these two, that's very definitely we can suspect fowl cholera caused by Pasteurella maltosida. Apart from that, you could see the hemorrhagic duodenitis. So hemorrhagic duodenitis, pinpoint necrotic foci, and the petechial hemorrhages on the heart, and petechiae serosal congestion of the ovaries, that we could make diagnosis as fowl cholera. And if we suspect, it's very simple to diagnose. Just make impression smears either from the liver or from the heart. Make smear through Leishman staining. We could easily see the bipolars. That is a characteristic lesion. Characteristic feature of the Pasteurella maltosida. It's very easy disease to diagnose immediately without need for any sophisticated lab. So if it's localized, we can trim and use, and if it's a septicemic one, we have to condemn. Another one is avian tuberculosis caused by Mycobacterium avium. And we have seen that Mycobacterium avium is not causing human diseases, but there are reports of human diseases caused by Mycobacterium avium. So we have to take care. That's all. but this caused very severe disease in pigs and rabbits. Humans are resistant to but there are some literatures which cause human diseases also. And frequently, the serover 1 and 2 are being isolated from AIDS patients, and not like animals and humans. In case of animals, we see the lesions in the lungs. But in case of human tuberculosis, we could leave the lesions, so mainly the liver, skin, and bone and intestine. Why we have to eliminate? Because of unthriftiness. They are the sources of for pigs and sheep, and it sensitizes the cattle for the tubercle testing. Though the cattle are not being affected that much, but they show positive for tubercle testing, and in some reports they isolate Mycobacterium avium from humans. So it's very easy to identify when we open, and in case of clinical signs, not much specific clinical signs unless apart from diarrhea and lameness. Because of the emaciation, the bird shows a keel and knife edge, that is emaciated caudus with prominent keel bone, what we see. In case of water birds, it shows apart from the other lesions, there are some abscess and nodular growth in the ice being joints. Like pox, it shows lesions in case of water birds. PM lesions, if you see, we could see the nodules, granulomatous nodules in the liver, intestine, and spleen and bone marrow. Sometimes if we suffer from the lymphoid leukosis, this tubercular, the small tubercles, it's easily enucleated by using hands. And lungs being affected only in the water hole, not in chicks, water hole and ducks. Spleen, it shows normally. And the pale yellow nodules in the bone marrow is almost a confirmatory diagnosis by gross pathology. Judgment, so we have to condemn the focus. And another one is a chronic respiratory disease which affects the air sacs of the poultry, which shows a yellow caseous materials in the air sacs caused by Mycoplasma gallisepticum. If it's again localized lesion, we could trim and use. If it's a generalized asacolitis, we have to condemn. And if you see only pericarditis and perihepatitis, just trim that part and it's approved for human consumption. Another one is histomoniasis. This is protozoan disease causing disease, blackhead disease, and which is transmitted by the sickle worms. And it shows a cyanotic hair, that's a blackhead, and yellow sulfur feces is another important one. Sometimes it shows bloody feces, that is confused with again coccidiosis, but the postmortem lesions are very classical in case of histomoniasis, that very clear circular yellow to white necrotic foci with white rings and the center depression. This is a very characteristic postmortem lesions, and it's considered as pathognomonic. And another one is syphilitis, that is a sickle wall. It's being very much thickened, about 5 to 6 times it's thickened, and we could see the necrotic material inside the sickle. So hepatitis and typhlitis are very important antipathognomonic lesion in case of histomoniasis. And if the bird is in good flesh, we could trim and use for human consumption. If both the liver and the intestine has to be condemned, after that the other muscles we can use. But if the bird is emaciated and septicemic, that has to be condemned. Next is coccidiosis. Of course, it's again another very easy disease to diagnose. We could see the bloody diarrhea, and if we take some samples, put it in the slide, put a cover slide. If you observe under the microscope, within a few minutes we could diagnose the disease, coccidiosis. And it was severe anemia and severe dehydration. And there are types of coccidia. That species, they affect some duodenal cord, mid intestine, or lower intestine, or it affects only the cecum. So in the postmortem examination, we could see that severe necrohemorrhagic enteritis based on the parts getting affected, but the lesion is same, severe hemorrhagic necrotic lesions. That's all. Again, if you want to, confirm this, just take the content from that. Just scrape the material from the inside the mucus of the intestine. Just put it on the cover slip, slide and cover slip examine. You could see the oocysts of the coccidia. And if the animal body is good, you can trim and approve. Or if it is severely anemic and emaciated, that has to be condemned. So just I covered some of the important infectious causes, and we could see some some miscellaneous conditions which need some judgment. Abscess, you know, there's a localized collection of pus. If it is localized, that part can be trimmed and the carcass is approved for the human consumption. And if it's generalized septicemic, and that has to be condemned. And bruises, that's a local wound that happens during transportation or unloading or improper handling, or that's if the bruising is local, that part can be trimmed and approved. Even if the affected area is fresh or wound with hemorrhage, that has to be trimmed and used. But if the changes are extent and with the systemic changes, that has to be condemned. Inflammation or there is no lymph node involvement, that can be trimmed and approved. There are some of the conditions that need condemnation of the whole carcass. The first one is septicemia. Septicemia is not a single condition. Septicemia is the one caused by so many other infectious reasons. So if we suspect the septicemia, what are the things we have to look for? The carcass is dark red in case of acute septicemia. If it's delayed, it may turn into pale or blue. And it leads to severe dehydration, so the carcass appears severe dry. We could see that one when we peel off the skin, we could even hear the sound like dryness, and we could feel the dehydration signs in case of meat. And all the internal organs, particularly the important vital organs like the liver, kidney, and spleen, in septicemic cases, they are severely congested, that is enhancement of blood vessels, not memory, and it's swollen sometimes. And sometimes, in case of some disease, we could see the generalized muscle wasting. But anyhow, all these, if we see these things, that carcass has to be condemned. This we could see the general emaciation, and in the next one is last two images on the top is a septicemic condition. So we could see the gelatinization of the fat. The last image, right top, is hot. You could see the fat being gelatinized. You could see the like a jelly appearance of the fat. And another miscellaneous condition, which is overstalled because of the temperature missing, or it's being held in the scalding tank for a long time. In this, if this overscald lesions like white discolorations in the top and deep breast muscles, the cooked appearance, this has to be condemned. Only the top layers of the breast muscles, if we see the cooked appearance, that we can trim and we can use. Sometimes if the cut in the neck is improper or it's not severe properly, there is improper bleeding out. So the bird enter as live bird into the scalding tank. Because of the temperature, the remaining blood inside the body, it goes into the blood vessels. So the blood vessels getting engorged, and so the entire carcass inside the blood vessels, you could see the severe congestion. That makes the thing as a cadaver, and it's unwholesome for human food. We have to look for the cherry red or purple, particularly in the lower region, or sometimes in the neck regions. It's because of the, as we discussed, it's a no cut or improper cut in the this. Sometimes it may confuse, like if the cut is good, sometimes we could see the blood accumulation, blood clots inside the body cavities, in the abdomen, in the. But if you see the blood clots, that they are not cadavers. Cadavers are the congested blood inside the blood vessels. The blood is accumulated, and we have to condemn the birds which are dead on arrival. They have to be removed from the slaughter or from the integration line. They are not used for human food. We have to look for the discoloration on one side. This is important one. We studied hypostatic congestion. After death, the animal is on one side. So because of the gravitational forces, the blood is being pulled on one side, which is on the ground side. That shows the discoloration, mainly red to purple color. That's hypostatic congestion. That is the indication that the bird is dead already, and it's arrived dead. And the neck is very floppy, and the bird is cold to touch, but the other things are feel stiff. And when we open it, smells poor, bad. Another condition is ascites. Ascites, for this also there are so many reasons. So it starts from the normal physiological, like variation in the altitude and pressure variation, and sometimes the liver affections, and some viral diseases, some mycotoxins which cause severe liver damage, which cause severe ascites. And sometimes some toxins, dioxins, they cause ascites. So birds with ascites, they have to be condemned. And another one is miscellaneous condition, egg peritonitis. This comes under colibacillosis also, but apart from that, there are some other conditions which cause these lesions. And you see, when we open the peritoneal cavity, the ova being ruptured, and it is exposed to the peritoneal cavity. So this contain, become infected. It produces severe inflammatory lesions, produce severe peritonitis, and that leads to severe septicemia. That's why it makes the carcass unfit for the human use. So we have to condemn the carcass affected by egg peritonitis because of the severe septicemic lesions along with severe peritonitis. So with this small talk, I conclude my talk. Just to, as a take-home message, these are all the diseases which are transmissible to human, as suggested by most of the researchers, and including our ICMR, right? Avian influenza, chlamydiosis, salmonella, colibacillosis, encephalitis virus is under again questionable. Avian TB questionable, Newcastle and cryptosporidiosis. And with this, I conclude my talk. Ruben, are you there? Anybody is there? Dr. Selvam?
I am there, sir. I am there, sir.
Yes, please, doctor.
Yes, sir.
Yes, thank you for your wonderful lecture on antemortem and postmortem inspection of poultry, Dr. Thangapandian. Participants, is there any question regarding the session? Feel free to ask.
Thank you, Major, for the opportunity, and Dr. Rajendra Kumar and the Dean and Dr. Samsudin, sir. Thanks for the opportunity.
Thank you, sir. Thank
And
you.
if any questions are there, I would like to take some 2 or 3 questions regarding antemortem and postmortem. And if it's with some slaughter procedures, our Dr. Selvam or Wilfred Ruben will intervene and answer.
If there's no question.
Otherwise, can I conclude?
No questions, sir. Well presented.
Thank you, Dr. Ruben.
Then if there is no question, then we will disperse. Thank you, Dr. Thangapandian, once again.
Thank you, Major. Thank you.
Thank you for spending your valuable time with us. Okay, participants, and we will, if you want to refresh, you go for refreshment, then we will join back by 3 o'clock.
Okay, sir.
Thank you.